Hello, welcome to the on-demand training for our student pharmacists. I'm Jesse Schuster, and I'm presenting the presentation from myself, Dr. Bianca Korkus, and Lynette Moser. The reason why we're here is because we are giving our students the ability to update the medication list in the electronic medical record. Sounds pretty crazy at first, but with great training, tutelage, our students will make a greater impact for our patients. Our expectations of the student are to display the skills necessary to complete a thorough, complete, best possible medication history. From that information, update the patient's home medication list. Based on those changes, be able to communicate them to you, the preceptor, and also to the primary team as necessary. They should be able to identify drug-related problems also from this data. And lastly, document the interventions that they've done by getting this medication history. When this happens, everyone wins. The patient wins because they're going to get the right medications sooner and be educated about those medications. The preceptor wins because the student is helping them extend the services of the pharmacy. And of course, the student pharmacist wins because they are gaining much needed skill in talking to patients and figuring out drug-related problems. Here are the objectives for this presentation. Let's talk about transitions of care. This is a nice diagram of how complicated and important transitions of care is. The patient is seen by multiple people for their well-being. And it's important to have appropriate communication with each person involved in the patient's well-being. When there are breakdowns or gaps in that, the patient may be at risk for adverse drug events or losing their health. The general definition for transition of care is the movement of a patient from one setting of care to another. This applies to a hospital, but many other places, as that diagram describes. It could be from one primary care doctor to a specialist, from a nursing home to a hospital, from a nursing home back home. During this transition, patients are definitely vulnerable to medication-related errors, as I described, with breakdowns or gaps in communication. Here's some data about adverse drug events after a patient leaves the hospital. About 2/3 of these events are related to medication use. Of those events, 29% are considered to be serious or life-threatening. 60% of these events could have been prevented with proper intervention from a healthcare provider, and that's us. So are we on board or what? Let's help these patients out. Looking at the drug events specifically, the survey done in 1995 to 2005 found over 4.3 million events that related to the patient actually seeing their primary doctor or going to the emergency department. And as time progressed through that survey, the rates almost doubled. The predictors that the investigators saw were related to age and polypharmacy. Now looking at hospital readmissions, which is something we want to avoid, and the reason for that is this slide here. Medicare has 20% readmission rate within 30 days, which translates into $17.5 billion in medical costs. So CMS instituted a goal for hospitals to be reduced to less than 20% by 2013. And if that's not happening, they can penalize hospitals and withhold or change payment to hospitals, which obviously would lose money for the institution. So to help change things around, pharmacy, seeing that a lot of these are drug related, is definitely getting on board. ASHP, APHA had a contest where different places would submit their best practices for transitions of care. From these submissions, the group picked the top 8. The key activities for pharmacy that were chosen as the winning programs, each of these programs had pharmacy involved in medication reconciliation, patient counseling, follow-up once the patient left the hospital, and more. And the people involved were everybody in pharmacy, from the pharmacist to students to residents to pharmacy technicians. And the results showed sustainable results that showed a decrease in 30-day readmissions. So what is medication reconciliation? It's the process of identifying the most accurate list of medications that a patient's taking, including the name and dosage and so forth, and comparing that to the external list of medications obtained from either the patient or someone else. So we talk to the patient in the hospital, get the best possible medication history, and then it's decided what the patient is to continue here in the hospital. When that happens, many things can cause errors, like an incomplete medication history, or there could be formulary substitutions, non-formulary agents that can cause issues with the patient getting the right medications. So what happens when our student pharmacists get involved? Everything goes up that we want to go up. We see that more patients are seen and get a medication history. And with that, more discrepancies are identified and resolved. We have more clinical interventions, and the student gets an enhanced learning and rotational experience. Here's our diagram for what's expected for the student when doing a medication history. Each step has very special detail that we can't fit in the presentation, but should be considered as they go through the process. So the first step is the medication history, which we have a video for that you'll watch. During that medication history, ideally the patient or caregiver is interviewed by the student and gets an up-to-date medication list and finds another source to confirm that list, such as a pharmacy. If there's any issues, the patient will confirm any changes that were found at the pharmacy or any other discrepancies. Once the students collected all the data and confirmed the best possible medication history, they will update the medication list in the EMR. Shortly after that, the student notifies the preceptor about the changes. During that time, the student will document the intervention in the Power Forms ad hoc section. The preceptor promptly reviews the medication list changes. They can then discuss the teaching opportunities of those changes and get any clarifications if needed. From there, the student can contact the primary team for any interventions found in discrepancies from the medication history. And at the preceptor's request, they can complete a power note. So how do we ensure our students are going to be competent? First is what we're doing right here with systematic training. And secondly, we have to assure competency with an assessment. Our goal is to have the systematic training where the preceptor, or on their first day of rotation, the student will be introduced to the training manual on that day. They'll review it and ask questions as needed. The student will then review our medication history video. And then the preceptor can decide to model a med history before having the student do one on their own. Looking at the assessment of competence, the student will complete a lecture panda, written competency, and then the preceptor will also evaluate the student during a medication history. That can be either a live one with a real patient, or the preceptor can be in the role of the patient to evaluate the student. We have a tool where the preceptor inputs the data for the assessment and a score will be made. Now it's time to review the MedRec video. Before watching the video, please grab or copy out our assessment form. This one right here. So as you're watching the video, have this and grade the student and see how they did. So please take a moment to pause this video and watch the video of the medication history. What did you think of the video? How did the student do? Based on our assessment, we gave the student a 13 out of 16. As you can see for question 2, we chose not applicable because there were no guests or visitors in the room with the patient. For questions 3, 6, and 7, you may need to see the student do this a couple more times to get a better appreciation of how they're doing on those particular questions. Now we're going to talk about how the students are going to update the home medication list in the EMR. So the first step is to bring up the window where you can modify the home medication list. So once you're in the medication list section and you have the home medication there, click Document Medications by History. These are the issues you will commonly find when updating the list. The first is duplication of orders. So once those are clarified, whether it's a therapeutic duplication, such as 2 statins, or multiples of the same medication, and maybe different strengths, clarify the strengths. Next is the removal of a medication the patient's no longer taking. So anytime you're removing a medication, questions should be asked of our students and of ourselves. Was this medication replaced with something? Was it appropriately discontinued? And what's happening there? So we have to understand why we're getting rid of the medication before deleting it. Should we replace it with something? Or did something happen where the patient no longer has access to it? Next, if there is a missing medication, we would simply add it, ideally confirming that the patient's taking it, if it happens to be at the pharmacy and the patient didn't mention it. So before adding a medication, you have to ask certain questions as well. Next is if there's an incorrect dose or route or directions. When this happens, we would use the Modify section to update the dose or re-enter the dose as a new prescription because it was initially documented as a prescription. We have to complete it and then re-enter the medicine as a documented medication. And we could also update compliance. Starting off with completing a medication. After you click Documented Medication by History, highlight the medication, right-click on it, and choose Complete. If Complete is not an option to choose, then click Cancel DC. After that, you would click document history. To add a medication in that same window we had up, simply click Add, and this will bring up a search catalog, seen here. Start typing the medicine or vitamin, supplement. It's a very powerful search catalog where many things are added that are not necessarily drugs. There's herbal supplements and things of the like, Centrum, specific vitamins as well. So type the medicine and then hit enter, and that'll bring up the extensive search catalog results, and then you would find the product you want to select with the dose. As you can see on the screen, we have lisinopril here. If we knew the exact dose, we could just choose it from here or hit enter to find the exact dose we would like. Once we've done that, this next window with order sentences will populate. You can choose none or one of the pre-selected ones because you're still able to modify it before documenting it. So highlight one of the options and click OK. That'll bring you to this screen right here. The green dots, as it mentions, have been auto-populated, but they all can be modified before documenting the history. You can change the number of tabs to a half tab or 2 tablets. You can change the frequency. If you don't see a frequency, start typing it or choose the option that says See All to go through different directions. There's many different ones, and you could most likely find the one you're looking for. Before documenting, please choose compliance so that we can see that the patient's still taking it, or if for whatever reason they're not taking it due to side effects or they ran out of prescriptions. Click compliance to bring down a drop-down menu that'll give us more options to choose. Most commonly, it'll be still taking as prescribed. To modify a medication, simply highlight the medication and right-click, Modify. Change the directions or the number of tablets as it is seen to be fit. Transitions of care on your rotation. Why are we doing this? First, the medication history on admission. When we're talking to the patient and then subsequently the pharmacy, we're able to help out with adherence and understand the patient's adherence, as well as look to coordinate medications as the patient gets ready for discharge. When you talk to the outpatient pharmacy, it's important to ask them, is the patient getting these medicines regularly and on time? And also, what prescriptions need new prescriptions or refills? It's key to consider the patient's hospital history before labeling a patient non-compliant or non-adherent, because a patient could have been in multiple hospital stays, which obviously they wouldn't pick up their prescriptions every 30 days. So keep that in mind. As the patient's here, we're evaluating their medications. What have they used in the past? What are they currently getting? And how that impacts the future? What are they going to be going home on? And that's where discharge counseling comes in. We want to make sure the patient goes home and starts on the right foot, knowing what to expect with the new medicines and stopping old medicines if that's the case. And once they're out of here, we'd like to follow up with them to make sure they're staying on the right foot. Checking up on them to make sure they have the medicines and there's no issues, and also to make sure they have a plan to see their primary doctor or some doctor for follow-up. Now moving on to the training manual. Together we have a dream that even though we face the difficulties of today and tomorrow, we still have a dream. We want to have the dream of a deeply competent student. We have a dream that one day students will rise up and participate in their own orientation, and they'll be universally expected to contribute to extending the services of the pharmacy department to improve the care of our patients. With that, we propose a centralized orientation day for all traditional students. Our lab students here will help lead the day. They will follow this orientation manual. There will be a lecture Panda test for all the students to complete and stored so that we can demonstrate their knowledge about documentation and how to navigate the EMR. A competency checklist will be completed by preceptors as the student engages in different activities. Now moving on to the specific manual. We have the general orientation section that gives guidelines on customer service, dress code, HIPAA, and so forth. There's also a computer orientation that helps our students get acclimated with our computer system. First, we have a competency for chart review, which the patient can be given to the student from the preceptor or using a test patient. We want the student to be able to find these things in the EMR. And we have in the manual specific information on each of the different tabs in the EMR and how they're useful. So the students would review that on the first day, and after that, they would do this scavenger hunt. And then the preceptor can follow up with the student the next day. Also, we'll have the sections on documentation in EMR, how the student can update and add allergies, to update the patient pharmacy, of course, how to document medications, as we discussed, how to create power notes, and how to document interventions in the ad hoc form, and of course, to document patient education. Looking at the competency for documentation, we expect a passing grade of 80% or higher, and the checklist will be completed by the preceptor once the student demonstrates skill. Some examples of the competencies are when the student updates the medication list. How are they doing? Are they removing the right medicines? Are they adding the medicines correctly? And so forth. There's a transitions of care section that has the different fields highlighted here and how we can help our patients get their medications appropriately. There's a transition of care checklist that gives a step-by-step approach to the patient in the hospital, making sure we've done the med history, we've educated the patient, and gotten them ready for discharge. There's an introduction to farm web, which also comes with it, a scavenger hunt. Now, students may have a yellow book. We want to make sure they know the most up-to-date information is on farm web. The student can complete this with discussion with the preceptor. We're going to have a section on farm web in research and education for students. In there, we're going to have this manual. We're going to have the medication history video, a SNAPS video for precepting, and the different checklists. Also in the resource document section, we'll have patient interview templates, a med release form for using when patients are getting medication histories, a medication calendar, the transition of care checklist, a template for phone calls, as well as different examples of the patient monitoring forms. With that, we want you on board. How can we improve this process? Let us know. Please give us feedback. We appreciate your time. Thank you.